The Health and Human Services, or HHS, and Centers for Disease Control and Prevention, or CDC, logos appear on the screen, then move out of screen. A satellite picture of North America appears with the title Success Stories in Radiation Emergency Preparedness sliding in from the top. An image of an advertisement for a radiation volunteer capacity seminar is shown. Then, an aerial video of the city of El Paso.
Things really started moving forward once we were able to demonstrate the importance of public health in a radiological emergency. After that, we were better able to work together to put local, state, and international plans in place.
The satellite picture of North America reappears and zooms into the outlined area of El Paso, Texas. Above the outlined area is a map marker and box with the words El Paso Department of Public Health, building local and international relationships to improve radiation emergency preparedness. Then the scene shows Angela Mora, Interim Health Director for the City of El Paso Department of Public Health, standing in a room and speaking to the camera.
Hello, my name is Angela Mora. Together with my colleague Ruth Castillo, we lead a team of 4 people who work in the Radiation Preparedness Program here at the City of El Paso Department of Public Health. Our focus on radiation preparedness started in 2013, when we staged our first tabletop exercise here in El Paso.
An image pans of a metal cast sign. The most prominent words on it are City and County of El Paso. Then, a picture shows a large sign outside the health department describing the different departments and where they are located. After that, a picture shows the health department's building sign, which reads, The City of El Paso Department of Public Health, where health knows no borders.
In that exercise, we invited law enforcement, emergency management, universities, and elected officials to discuss how we would work together to manage a radiation emergency. That exercise showed our partners how critical our public health role would be and started us down the path of developing a radiation response plan.
A picture shows a portal monitor outside with a sign that reads, Please wait here. Then, a community reception center flow map is shown indicating its different stations and stages.
After that, we received grant funding to purchase equipment, prepare for our population monitoring role, and develop plans for hosting a community reception center, or CRC. As our response capacity grew, we began to increase the size and scope of our training and exercises. By 2019, we were able to conduct a full-scale exercise with our Texas partners. That helped us to prepare locally, but we also needed to ensure our plans could function at a higher level.
An aerial drone video of the city of El Paso with Juarez, Mexico visible in the distance.
We had to make sure we were prepared for radiation emergencies that could cross state and international borders.
The scene changes to show Ruth Castillo, Public Health Emergency Preparedness Program Manager at the City of El Paso Department of Public Health.
Planning for the Pope's visit to Juarez, Mexico in 2016 helped us to think through how we could expand our partnerships.
An image of Texas appears with the title Binational Radiological Emergency Advisory Council and highlights 3 areas: El Paso, Texas, New Mexico, and Juarez, Mexico. Then a list appears with the following items: fire departments, hospitals, the Office of Emergency Management, the Department of State Health Services, and Public Health.
That set the foundation for the Binational Radiological Emergency Advisory Council, or BRAC, in 2017. The BRAC brings together key radiation colleagues from El Paso, Texas, New Mexico, and Juarez, Mexico, and includes officials from fire departments, hospitals, the Office of Emergency Management, the Department of State Health Services, and Public Health. Getting to know each other through BRAC meetings has streamlined how we respond to incidents we have had in the area. Because we have so many disciplines together in one room, we are able to address the needs that arise in our communities in a comprehensive way. This approach has helped us to take our first steps towards creating a more collaborative, multi-state radiation emergency response.
The scene changes to Angela Mora. Then it shows a video of an ambulance, lights on, driving toward the camera from far away and turning into an emergency room lane.
Going forward, we plan on addressing the opportunities for improvement we identified during our 2019 full-scale exercise. For example, we aim to improve our communication plans with regional partners, EMS, and fire departments to reduce misdirected or duplicated information. We want to continue collaborating with EMS to establish a transport protocol for patients contaminated with radiation. Another of our main areas of focus is ensuring that we accommodate for vulnerable populations at CRCs.
The scene returns to Ruth Castillo.
We'll continue to use break activities to work closely with our state and international radiation partners.
A video is shown of Ruth Castillo sitting at a computer and answering a phone call. Then, the video shows Ruth and two other individuals discussing a topic in an emergency operations center.
Through those efforts, we'd hope to expand agreements already in place for expedited communication with New Mexico and Juarez. We'd like those agreements to include training and equipment for radiation emergencies in the future. We've also applied for grants to conduct a CRC exercise jointly with Juarez, which will allow us to build the infrastructure we need to manage national and international emergencies. The Centers for Disease Control and Prevention, or CDC, has helped us along the way.
A video is shown of the front driveway and sign of the Centers for Disease Control and Prevention.
When we started in 2014, most of the public health and radiation information we had came from the CDC.
Then, 3 pictures are shown of CDC posters, guides, and resources displayed in a conference booth and table.
Their educational materials, fact sheets, and population monitoring toolkit help us establish the initial framework for our plans. Since then, CDC subject matter experts have helped us as we plan and executed our full-scale community reception center exercise. They attended the CRC in person to evaluate our process, provide a Radiation 101 course, and collect throughput data on individuals as they move through the CRC stations.
The scene returns to Angela Mora.
Completing a full-scale exercise was a result of years of effort and collaboration. We are proud to work with our local and regional partners to prepare El Paso for a radiation emergency. We're in this together, and seeing how our efforts have strengthened our relationships with our local, state, and international partners makes this preparedness work all the more valuable.
The screen flashes white and is then replaced with a blue screen with white dots on the bottom and the message, "For more information on radiation, visit www.cdc.gov/NCEH/radiation/emergencies/ or call 1-800-CDC-INFO. Below that are the Health and Human Services, or HHS, and Centers for Disease Control and Prevention, or CDC, logos. Then the website and phone number disappear, but the logos remain. Above the logos now appears the message, "The mention or use of any healthcare products or providers does not constitute or imply endorsement by the Centers for Disease Control and Prevention."